Guys, today I'm going to talk about the principle in homeopathy according to which we do not prescribe for little things. So, what do we mean by little things? Of course, we mean every attack of the snuffles, every little headache, or every little pain. Do not give a separate remedy for every little thing. Um, In the organon, this is expressed in aphorism 150. If a patient complains of slightly accessory symptoms which have just appeared, the physician ought not to take this state of things for a perfect malady that seriously demands medicinal aid. Little things, little symptoms that an organism manifests are not supposed to be treated. They are simply little strategies, little um, techniques that the organism uses to retain or regain balance. Now, Kent says you could prescribe for a cold, but only when it is not an ordinary one. So that means if you have a very serious cold, very high fever, um, some serious symptoms, and clear and strong symptoms, then you may prescribe for it. But if the cold is likely to cause serious trouble, then you must prescribe for it. Slight indisposition, however, should not receive remedies. Slight things should not receive remedies. The body was not designed to receive constant impulses, energetic impulses, of course, which homeopathic remedies are. So they are frequencies administered into the body, and the body needs time to process those. You can't give a remedy every week, every day for some little thing, because the body will be disordered. You will have patients that will come to you at every change of the wind, every attack of the snuffles the baby has, at every little headache or every little pain. These people are, of course, called the hypochondriacs. We have a lot of those people, especially after COVID, um, or actually um, the purpose of COVID or the effect of COVID was that people were instilled with a kind of anxiety about health, even more than previously. So I think that epidemic, pandemic, whatever, is created um, just a huge number of hypochondriacs, even people who are susceptible to that kind of thinking, um, were actually kind of triggered into that state, I think. So if you then, like Kent continues here, if you then proceed to change your remedy or prescribe for each one of these little spells of indisposition, you will, in the course of a little while, have such a state of disorder in the individual that you will wonder what the matter with the patient. So Kent says that the patient will be in a state of disorder. So that means every frequency you give alters the symptom pattern and creates disorder, creates chaos, and you will not be able to diagnose the patient after a while because they will become chaotic in their symptoms. You had better give her no medicine at all, and if she is wise and strong and can feel confidence, you can say to her that she does not need medicine for this attack. But occasionally give her a dose of constitutional medicine when these little attacks are not on. Of course, that is the standard procedure in homeopathy, is to give one dose of constitutional medicine infrequently. So maybe even uh, twice a year or once a year, even. And that is, of course, the standard procedure in classical homeopathy and not modern nonsense homeopathy, which has no rules. So-called modern. While you are young and cannot hold these patients with an iron grasp, when they come to you, you had better give them placebo and let the indisposition pass off of itself. So you have the crazy patients, the hypochondriacs, and that's a big problem. But you might even be young and not very good with patients, and not very good at holding them with an iron grasp. In that case, you will have no control over the patient, and one solution is to just give them a placebo, so they feel like they got something. They might, um, their hysteria might reduce a little bit. So, on the other hand, of course, it is an easy matter to prescribe for severe acute diseases. We talked about this. If the acute disease is severe, feel free to prescribe for it. Yeah. You will be astonished that after prescribing a number of years and your patients have gained confidence in you, that when they come in with these trivial ailments, they won't have them after a few powders of sugar. They will say, "Doctor, my trouble went off splendidly." That is what is meant by letting the little things alone. So what does this all mean? Basically, if you leave your patient alone in homeopathy for several months, even years, and they will their symptoms, their energetic state will regain balance, and they will shed all of these little symptoms as well. But you have to leave them alone. So that's it for today. If you would like to do a homeopathic consultation with me, you can find my email, Telegram, and Signal and Simplex in my channel description.